Hello and welcome to Group 6's presentation on gastrointestinal ischemia.
The general information surrounding gastrointestinal ischemia. So gastrointestinal ischemia is a gastrointestinal disease. It can be referred to as other ischemic diseases within the digestive tract, such as mesenteric ischemia and intestinal ischemia. The general issue of gastrointestinal ischemia manifests itself generally when blood flow is decreased or cut off completely, and or because of narrowing of arteries. A decrease in blood flow corresponds to a decrease in oxygen, and a decrease in oxygen means that organs forming part of the digestive system will become damaged. Moving forward, gastrointestinal ischemia is considered a severe condition that can lead to fatality if left untreated. In the pictures above, we show exactly where gastrointestinal ischemia is located and what parts of the body are being affected. So, the stomach, the liver, the small intestine, and the large intestine, to just name a few. Moving forward, we want to talk about the digestive system. The digestive system is a system of organs responsible for ingesting and digesting our food to make use of it as energy for our body. The digestive tract is composed of the mouth, the throat, the esophagus, the stomach, the small intestine, the large intestine, the rectum, and anus. In the picture to the right, you will see that in addition, there are other organs that help with this digestive system, such as the liver, the pancreas, and the gallbladder, which help with enzyme secretion for digestion. Now we will go through each part and explain a little bit of how they play a role in the digestive system. The mouth has salivary enzymes that begin carbohydrate digestion, and while teeth break down food by chewing. The pharynx ensures that food goes into the stomach and prevents choking. The esophagus carries food down from the mouth to the stomach. The stomach secretes gastric juices, hydrochloric acid, and activates enzymes. And the enzyme pepsin digests protein. Liver makes bile, and the gallbladder stores the bile. The liver also helps break down fats, store vitamins, and iron. The pancreas makes bicarbonate to neutralize stomach acid. It also contains insulin and regulates sugar levels. The small intestine digests protein, fats, carbohydrates, and is covered in villi for absorption. The large intestine absorbs water and electrolytes from stool, forming fecal matter. The rectum is the lower end of the large intestine that segues into the anus. And finally, the anus is the opening where bowel movement leaves the body. To the picture on the left, it is the duodenum, and it is supplied proximately by a branch of the common hepatic artery called the gastroduodenal artery that stems from the celiac trunk and gives the superior, anterior, and posterior pancreatic duodenal arteries. And so, the connection with the arteries and the digestive system in between is that without natural blood flow, we get what we call gastrointestinal ischemia. That is why it is very important to have blood flow being regulated at all times. So far, we've talked about the digestive system, what generally gastrointestinal ischemia is, and even some of the arteries that form part of this digestive system. Now we will talk about digestion and absorption. To the left, you will see a microscopic intestinal villus. Now, digestion is a complex process that turns the food we eat into nutrients and water-soluble molecules to be able to enter the bloodstream for energy, growth, and cell repair. Absorption occurs in various parts of the digestive system. The villi, as I just previously mentioned, is what we see under the microscope, have adaptations that assist in the absorption of food into the intestinal cells. They provide a large surface area and constantly move to help food move and mix with the enzymes. They also provide a rich blood supply to the intestinal cells via capillaries. This means digested food can diffuse or be actively transported across the intestinal cells and into the bloodstream to be carried to the liver via the hepatic portal vein, as previously mentioned. This blood supply traveling from the small intestine will therefore include water, mineral salts, glucose, amino acid, and some vitamins. Once they pass through the liver, the hepatic vein carries the blood to the heart via the inferior vena cava. Regarding gastrointestinal ischemia, as mentioned, it occurs when blood flow to the intestines decreases because of a blockage in an artery caused by a blood clot or narrowing of an artery due to the buildup of deposits. So you see, if this blood supply is being altered, it hinders the normal blood flow and therefore affecting the small and large intestine. And just to recap, to the right we will see a small intestine, a kind of little infographic that shows us the serosa, the longitudinal muscle, the circular muscle, the submucosa, and the mucosa, following what it actually looks like from the inside, which is a kind of fold of the intestinal lining, which what we just previously mentioned, the villi, which includes the capillary, the lacteal, the arterial, and the venule. Again, just to reiterate that if this blood supply isn't being regulated constantly and there isn't a normal blood flow, we have these diseases such as gastrointestinal ischemia that will and can be fatal to the human body.
Now let's get started with the second part of the disease summary. First, let's begin with the history of the disease. So, some historical background on gastrointestinal ischemia. Little is known about who discovered the disease, but one of the first notable pieces of literature about all aspects of it was published in 1971 as Vascular Disorders of the Intestines by Scott J. Bowley, Lawrence J. Brandt, and Frank J. Vieth. In it, describes the evolution of our knowledge of the disease from the initial stage of recognition of the condition and its manifestations through the phase of the first attempted treatment to our present-day attempts to diagnose and treat the disease. A picture of said publication is shown here. Now on to the natural history of the disease. If left untreated, those with the disease may face the following other conditions. Death of intestinal tissue. If blood flow to your intestine is completely and suddenly blocked, intestinal tissue can die, other known as gangrene, as shown in the picture to the right. Perforation. A hole through the wall of the intestines can develop. This results in the contents of the intestine leaking into the abdominal cavity, causing a serious infection, other known as peritonitis, as shown in the picture to the left. Scarring or narrowing of your colon. Sometimes the intestines can recover from ischemia, but as a part of the healing process, the body forms scar tissue that narrows or blocks the intestines. And in some cases, gastrointestinal ischemia can be fatal. Next, let's cover the prevalence of the disease. The incidence of gastrointestinal ischemia is very low, estimated at 0.09 to 0.2% of all acute surgical admissions. In addition, as emphasized in the photo, women are 3 times more likely than men to have gastrointestinal ischemia, and individuals 60 or older, who are also depicted here, are at a higher risk as well. Seeing as this disease is quite rare, there are not more statistics on the prevalence of the disease, but as research continues, more data can be obtained. And lastly, for the disease summary section, the presentation of the disease. The average percentage of patients exhibit the following presentation of gastrointestinal ischemia. Mesenteric artery thrombosis, which is a blood clot in the main mesenteric artery. Mesenteric vein thrombosis, or MVT, which is a blood clot in one or more of the major veins that drain from the intestine. Nausea, as shown here on the left, vomiting and diarrhea, of which may be bloody. severe and diffuse abdominal pain without any localization, abdominal wall rigidity as exhibited on the right, Ham-positive stools, which is occult blood detected in stool, and postprandial pain, which is pain after eating in the upper abdomen.
Gastrointestinal ischemia has many potential causes. However, the main cause of gastrointestinal ischemia is blood flow through the arteries of the gastrointestinal tract diminishing or being stopped completely. This disease can be brought on by cholesterol deposits, blood clots, or tumors that narrow the arteries or close them off completely. For instance, the figure displayed shows a person who has plaque deposits along an artery, causing an area of ischemia along the superior mesenteric artery. People who are older than 50 or have conditions such as atherosclerosis, lupus, heart disease, sickle cell anemia, and even vasculitis are more inclined to develop gastrointestinal ischemia. In addition, people who are taking medications like birth control and hypercoagulants and drug users who smoke, consume cocaine, or methamphetamine are also at risk of developing gastrointestinal ischemia. A blocked artery is one of the more common causes of gastrointestinal ischemia. As plaque deposits build up along the walls of the artery, the blood that flows through the artery quickly diminishes, causing extreme damage. This is considered an early stage of gastrointestinal ischemia, where the patient might feel sudden abdominal cramps or sharp pains in a localized area. If the artery is completely closed off, blood can no longer flow through, and this causes a buildup of blood and waste that forms at the site of the clogged artery. Any tissues that do not receive the proper amount of oxygenated blood undergoes a process known as necrosis or tissue death. This brings about many painful symptoms such as extreme bloating, diarrhea, and increasing abdominal pain. At this stage, healthy pink tissue turns black and rigid and can no longer serve its function in the body. Thus, it must either be removed or replaced. However, in some cases, gastrointestinal ischemia can heal on its own before it gets to such a stage. The digestion of food is crucial in the system since food is the primary source of nutrients in the body. Gastrointestinal ischemia induces very catastrophic effects on the digestive system. For instance, pain or inflammation that is caused by this disease would make it difficult to eat and therefore ingest nutrients. The small intestine, in particular, is responsible for absorbing most of the nutrients in the body, including carbohydrates, fats, minerals, proteins, and vitamins. The large intestine completes absorption and compacts waste. Every part of the digestive system is connected, and gastrointestinal ischemia can create serious complications that adversely affect the system. Damage or blockage would prevent waste release and nutrients from being absorbed, which would consequently prevent energy use and the regulation of chemical processes in the body. If this disease persists, the digestive system could face extensive damage, leading to shock or death. If left untreated, this disease can also lead to a serious blood infection known as sepsis, which can affect other systems in the body.
Phenotype. Colonic ischemia is associated to the induction of inappropriate inflammatory episodes in a variety of diseases, which may actively contribute to ongoing disease processes, particularly through the disruption of the epithelial barrier function. When intestinal epithelial cells are exposed to hypoxia, they develop an inflammatory phenotype characterized by the production of pro-inflammatory markers, a reduced ability of the epithelium to restore after immune cell transmigration, and decreased ion and fluid transport. In Figure 2, there is a tissue of the colon and how it looks normally and when it is inflamed. I have also inserted where you can see the inflammation of the GI tract would look like in relation to ischemia and how it could inflame multiple parts of the intestine. What is this disease causing it to not work properly, and how would this work normally? As seen in Figure 1 is the gastrointestinal system. The esophagus is the tube that joins your mouth and stomach and is the first section of your GI system. Before being stored in the stomach, food goes via the esophagus. Because it produces acids to digest food, your stomach can hold up to 1.5 quarts of food. Food only stays in your stomach for a brief period since it is not absorbed, and little muscular contractions but force it down your small intestine. The duodenum, jejunum, and ileum are the three sections of the small intestine. The small intestine is also responsible for the absorption of nutrients into the circulation. Bile is fluid from the gut walls, and the pancreatic secretions interact with foods in the duodenum. This mixture of foods and fluids travels to the jejunum, where Carbs, lipids, and proteins and other nutrients are broken down into their basic components. Food enters the ileum, where it is absorbed the large intestines of nutrients and water into the bloodstream. Food and digestive fluids that aren't absorbed continue to pass through the small intestine and into your large intestine, your colon, where it is stored until you go to the bathroom. Intestinal ischemia can affect your small intestine, your large intestine, or both. Ischemia that occurs when blood can't leave your intestines, when a blood vessel, generally your artery, is stopped, the blood flow to your intestines is reduced. A blood clot can develop in a vein draining deoxygenated blood from your intestines. When the vein is blocked, blood backs up into the intestines, causing swelling and bleeding. This can result in the contents of your intestine leaking into the abdominal cavity, causing serious infection called peritonitis. This can also cause scarring and narrowing of your colon. Direct connection to blood circulation. In Figure 1, the circulatory system of the body, the cardiovascular system, transports nutrients and oxygen to all of the body's cells. It is made up of the heart and the blood arteries that run throughout the body. The arteries carry blood out from the heart, and while the veins return it. The blood vascular system resembles a tree. The trunk is the main artery. The aorta splits into two massive arteries that branch into smaller vessels. The capillary network is a network of microscopic vessels that connects the smallest arteries. In the human body, there are two blood circulatory systems that are interconnected. The systemic circulation transports blood to organs, tissues, and cells, ensuring that they receive oxygen and other critical nutrients. The pulmonary circulation is where the fresh oxygen we breathe in enters through the blood. At the same time, carbon dioxide is released from the blood. When the heart rests between two heartbeats, blood circulation begins. Blood flows from the atria, the heart's two top chambers, into the ventricle, the heart's two lower chambers, which then enlarge. The next phase is the ejection period, during which ventricles push blood into the major arteries, the celiac artery, superior mesenteric artery, and the inferior mesenteric artery, are three branches of the aorta that deliver blood into the gastrointestinal system. In Figure 2, you can see there's a clot in the mesenteric artery obstructing blood flow into the bowel. When one of the two major arteries, the superior mesenteric artery, which provides most of the small intestine, or the inferior mesenteric artery, which supplies the large intestine, become clogged, the intestinal ischemia ensues. Because the location is served by these arteries overlap, the arteries can attempt to compensate for blockages in other places. Reduced blood flow, on the other hand, will cause more injury to uncompensated tissues. Intestinal ischemia can also be caused by an obstruction into the intestine's venous drainage system. There are several general vascular conditions that can cause intestinal ischemia, such as, but not limited to, blood clots in other parts of the body, calcified arteries, impaired blood flow from low blood pressure, tumors, hernias, and conditions that affect blood vessels, all of which impede blood circulation.
So I'll be discussing the symptoms of gastrointestinal ischemia. There are two categories I divided into. So this one I will be talking about on the slide would be the acute. The other one's going to be chronic. So acute is usually located in the umbilical region, or like the belly button area, and the symptoms are severe enough that medical help is needed immediately. And then the photo on the right shows the sudden abdominal pain. It could be mild, moderate, or severe. There's also frequent forceful bowel movements or urgent need. The abdominal tenderness or distension. There's blood and stool, confusion in older adults, fever, nausea, and vomiting. And I thought the photo on the left of the slide was really cool. It just shows an ultrasound, an endoscopy of what it would look like to have intestinal ischemia. So I'll be explaining the chronic side, which is milder condition caused by partial blockages. And these people usually experience intermittent dull abdominal pain after they eat a meal, and the pain occurs due to the intestines needing more blood flow during digestion, and partially blocked arteries will be unable to supply the extra blood. So it's not necessary to seek medical help right away. These people might cut back on eating to avoid discomfort and will generally have substantial weight loss. And some people may never even get a proper evaluation until it develops into acute. So These symptoms include cramps or fullness, so about like 30 minutes after eating, and can last 1 to 3 hours. There's also abdominal pain that gets worse over the weeks and months. People usually have a fear of eating. Unintended weight loss, which is shown on the right corner photo of the slide. And there's also malnutrition that can happen. Diarrhea, so bloody stools once again, and the nausea and vomiting shown on the right corner on the top, which is also included in the acute. And then there's also bloating. Again, I incorporated this photo on the left. It shows the arteries being blocked and the clot forming. So the whole purpose of the treatments is to restore blood supply to the digestive tract, and it basically depends on what is limiting the blood flow. So if calcified plaques build up on the arterial walls and they obstruct the flow, angioplasty will be performed, which is the photo shown on the left, and I will explain more of it. And it's performed by making a small incision in the groin and using tubes and wires to the area via x-ray guidance. And then the narrow artery is then widened with a balloon, which is going to be step 2 and 3 of the photo on the left. And stents may also be used if needed. If there is a clot lodged in an artery, wires and tubes with x-ray guidance will be used too. And then a catheter will then be placed in the clot, and then the clot busting medication is used to break it up. And then the photo on the right would be if one were to have colon ischemia, so antibiotics would be used to treat them. Sometimes those can heal on its own, although surgery is needed in order to remove dead tissue or bypass blockage in the intestinal artery. So I'm going to incorporate this in the slide, though I'll be discussing it once I go over the overview. So there's going to be acute mesenteric artery ischemia, which is going to require surgery and antibiotics, as well as angioplasty. The chronic mesenteric artery ischemia is also going to require the angioplasty and the stents. And then ischemia due to venous thrombosis. If there's no damage, anticoagulant medication for 3 to 6 months could be taken, and that basically just prevents clots from forming. And as an overview, so surgical wise, there's an embolectomy, which is shown on the left side, which blocks circulation. There's angiographic, there's vasodilators and thrombolysis, also known as fibrinolytic therapy. It basically breaks down blood clots. That's going to be shown on the right corner on the top. And then anticoagulants, which is the last one I have, the right corner on the bottom, or antiplatelet therapy. It basically stops platelets from forming a clot. So I found these to be very similar to the angioplasty one. Embolectomy and thrombolysis basically have to do with the clots as well as the angioplasty, except one extends the arteries using a balloon. So the prognosis as a whole, I found a quote from this article saying the prognosis of acute mesenteric ischemia for any type is grave. So for the past 15 years, the all-cause mortality rate from acute mesenteric ischemia averages about 71%, which is a range from 59 to 93. If there is bowel wall infarction, it could be as high as 90%. And generally, as many as 50 to 80% of the patients die. And if they do survive, they have a high risk of thrombosis, which can hinder a lifestyle. So basically, that means getting clots again, like reoccurring clots. And then early diagnosis is critical because mortality increases after the infarction occurs. So like I said, about 71% is the mortality, and the photo on the left shows how the treatment progresses over time. and what those percentages are. And I found the photo on the right very interesting because it's a bunch of different diseases. And if you look in the middle, it says intestinal ischemia, and it is so interesting to see that the death rate is higher than the recovery. And then it compares it with all these other ones. So like colitis. Colitis has a higher recovery, and then the death is low, so on and so forth. And honestly, early diagnosis is very critical for this disease because the mortality increases after the infarction occurs, and sometimes people don't know that they have this until they get checked out. So that is the end of our presentation. Thank you for listening.
Thank you so much for watching our presentation on gastrointestinal ischemia. Here are our references.